The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rushed office visits, both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it may be too late. To my military family, I got your six. To my Sonic brothers, the light is bright. Today's topic, most common health issues in aging. All right, before we get into today's topic, it's the day after Election Day, and it looks like we're going to have more of the same. Well, you know, there's a saying that you get what you buy, okay? And don't complain. Do not complain. If you did not vote, don't complain. If you voted a certain way and we're seeing higher prices in fuel, you know, cost of living's going up, everything's changing, everything's going up, the economy's not doing well. You're not part of the solution, became part of the problem. All right, so let's go over some fast facts. I was doing some reading last night, and I felt that I should share this because it was interesting. Just two facts that I kind of have an idea of one, but the other was just new. Okay, between 2019 and 2022, 9.8% of physicians stopped practicing. Now, I kind of had an idea, but I wasn't sure about, the percentage. But I know that physicians are retiring early. We used to practice 30 to 50 years, depending on how healthy you are and if you had all your faculties, if you're still sharp. Not only that, physicians are retiring sooner, so, anywhere between, instead of, like I said, 30, 40, 45 years, it's only 25 to 30 years now, so they're retiring 10 to 15 years earlier. But now we're seeing right out of residency, so our junior physicians are either dropping out of residency or shortly after residency just leaving the profession. So we're seeing a loss on both ends of the spectrum. And the saying that it's due to the increased stress, okay, the volume, they have to see and not be able to practice the quality care, especially the seniors, because they have the experience that they want, the autonomy to be able to practice, they want to practice and be able to keep up the volume. Just not able to do it. And then the juniors who are coming out, they realize that this, it's just too much stress. This is not what they thought medicine was going to be. Yes, you're going to have to see volume unless you see a practice like mine, like a concierge, where the emphasis is on quality, not quantity. You want quality, okay? When you go to, your traditional practices, they're going to be seeing 30, 40 patients a day in order to make money. And that's not what medicine was designed for. Medicine was designed to see 8 to 10 patients a day. That's it. Quality. History and physicals an hour. Your follow-ups were 30 minutes. Now you're down to like a 5-minute office visit. How are you you don't know what's going on with your patient. You don't know your patient. How are you going to form an assessment and come up with a plan? You can't. It's just, I'm sorry, you just can't. All right, the second fact, which is new, in 2021, antidepressants and anti-anxiety prescribing represents 19% of 7 selected drug classes analyzed. That surpassed opioids. Okay. So, which were previously, prescribed at a much higher rate. So we're seeing an upward prescribing trend for those individuals who need behavioral medication due to increased external stressors. So what do? We need to work on our coping mechanisms. Seek help. Before you try to avoid medication if possible. Let's do it natural. There are all different programs out there that will help. So, to improve your, reduce external stressors and to improve your coping mechanism. We always say, nature, natural, try to keep things as natural. But if you have to, then you have to take medication. For me, I'm conservative, in my approach in medicine. I like to do things as natural as possible. If I have to prescribe, I do. All right, so last week I was talking about the common health topics, and I ended because I just ran out of time, so I just wanted to continue, but we're going to focus more on seniors. This is as seen with seniors nutrition. We have catchphrases such as pinch an inch, you are what you eat, and an apple a day keeps the doctor away, and they're used to catch the attention of a particular demographics. Like exercise, your eating habits often not good if you live alone or eat alone, okay? And that's what we see with seniors. But I'll just give you an experience with me. Now, I have a master's in nutrition. I eat healthy. However, when I was single, yes, I do cook. When I was living in Manhattan, I had my apartment and we had a diner in my building. So I'd go downstairs and just eat downstairs. And it's kind of like to socialize. Now, I'd eat my egg whites and, I'd have my vegetables and so forth. It was healthy. But remember, you're having someone else prepare your food. So there's going to be a little bit more saltier. It's going to be buttery. So the fat content is going to be a little bit higher. But I'd go down there and, and that's even me knowing better. But I would still do it, and then I would cook, when I would cook. And I said, okay, I have to cook, with my vegetables and my egg whites and so forth. But, I'd go down to the diner just to socialize. So if you didn't have that opportunity, you're going to eat alone. You're going to have, it's going to be poorer choices. Okay, it is important for seniors where for successful aging to eat foods rich in nutrient, avoid empty calories such as found in candies and sweets. We want to eat protein with high biological value, and that would be your tuna, especially tuna and water, chicken and turkey breast, egg whites. You can have lean red meat. Okay, we want to avoid meats that are marbled with fat. Okay, marbled with fat. We also, you want to eat low saturated fat, high poly and mono unsaturated fat. And there's a ratio for every gram of saturated fat, you want 2 grams of poly and 2 grams of mono unsaturated fats. We want to drink plenty of water to prevent dehydration, all right? So in my practice, I see seniors, and the first thing I do is I look at their skin. I see the wrinkling, and I'll say, well, you see this right here? I said, yeah, I'm getting older, and that's my wrinkles. No. That's called, you're seeing changes, and I show them, and I pull up their skin. It's called skin turgor, and you'll see tenting. And so I said, what this demonstrates is that you have dehydration, and depending on how slow or fast the skin snaps back into position, we can determine the percentage of dehydration. That could be anywhere from 1 to 7% or even up to 10%. And if you're 10% dehydrated, then you need IV fluid. That's how I was taught. For IV hydration. So we want to make sure you're drinking plenty of fluid. It's recommended. You see all the websites for women, 10 cups of water, and for men, 15 cups of water. Unless there is a medical condition, like if you have congested heart failure, you're going to have a low sodium diet. We're going to decrease the amount of water because of the issue, the medical condition. But for a normal individual who is healthy and has no issues, if you read in all the journals and all the health issues, they're talking 10 cups and 15 cups. Okay? So we have a minute left in the first half. That's how fast this moves. Again, this is the day after Election Day, and we're still waiting for the results. We'll see. Within another few hours, we'll know what's going on. All right. So if you want to learn more about Dr. Tommy O, I want you to go to drtommyo.com. That's drtommyo.com. You're going to learn about the services I offer, and I offer a concierge practice at the cost of less than a cell phone monthly bill. You're going to have Dr. Tommy O care for you. I'm also taking no-fault insurance or patients that were involved in no-fault or what we call motor vehicle accidents. You're going to get that quality care, that personalized service that you deserve. You're going to be treated like family. So give my office a call, and that's 631-980-8200. That's 631-980-8200, and set an appointment. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. If you wait, it may be too late. Today's topic, most common health issues in aging. All right, so we left off with nutrition. It's very important, as we get older. There's all reasons, I just said one here because you live alone, eat alone, but there's other issues. You can have, medical conditions. Let's talk about your teeth. You have dentures, you have pain in your mouth. You just don't want to eat. So there's so many different reasons why, and also socioeconomical, financial as well. So, all of these areas need to be assessed and try to address each one so you can make a difference in your nutrition. All right, so the next is mental health. It is said dementia is not part of aging. Dementia can be caused by disease, reactions to medications, vision and hearing problems, infections, nutritional imbalances, diabetes, and as well as renal failure. So for me, for example, all right, now I'm talking about when a senior comes into my office and there's some behavioral changes. Okay, a family member says, well, they're just not right. Something's off. They're off. They're not focusing. The first thing I do is I test their urine. Okay, I test their urine. I do a urine analysis. I do a dipstick. Why? I'm looking for an infection. A lot of times we see with infants, when they become very irritated, when they see a change in their behavior, and with seniors, a change in their behavior, there's a good chance that they have a urinary tract infection. So the first thing I do is rule out urinary tract infection. And if I see there's a urinary tract infection, I place them on antibiotics, an antibiotic that they're not allergic to if they have any allergies, because we want to avoid that. And I treat them, and typically they will start to return to their baseline after a few days on antibiotics. So that's why you have to do a thorough history. You do your physical, and then you do testing, and then we come up with I form an assessment, and then I come up with a plan, and I implement that plan. Did you know the most common late in life mental health condition is depression? All right. If left untreated, depression in elderly can lead to suicide. All right. Now, this is something because I'm not a geriatrician. I'm a family practitioner. I practice the full scope of medicine, from womb to tomb, but I'm not a geriatrician where almost my entire practice is 65 or greater. So here's a surprising fact. The rate of suicide is higher for elderly white men than any other age group, including adolescents. This is something I didn't know. All right. So that's important. So if we have, family members, seniors, you need to check on them. All right. With my grandparents when they were in their 80s, and then they were 90s. I used to, every 3 months, I would fly down to Florida, just check on them. And then my father would try down. We would do like leapfrog every other 3 months just to check on them. And I did this for years and decades just to make sure they're okay. That was just the way I did it, my family, I should say, just to check on them. All right, so the next would be environmental quality. All right, even though pollution affects all of us, government studies have indicated that low-income, racial, and ethnic minorities are more likely to live in areas where they face environmental risks. Compared to the general population, a higher population of elderly are living just over the poverty threshold. So they're seeing this type of environmental quality, decrease in quality, I should say. So I'll just give you an example. I was practicing in the South Bronx 16 years. I used to make project calls. We say house calls, project calls. So I'd go to the apartment. So I know a patient had an appointment today. They didn't come in. So my staff would call. And they said, well, they can't get up. I said, all right, I'm going on lunch because I would eat in a local bodega. And on the way there, I'd just stop in and I'd make I called it a project call. I'd go to their home. And, so I'm inside and I'm seeing their environment. I mean, it's dirty, mildew, rats, and you have roaches literally walking in front of me on the floor. You have roaches, so they're living in this type of environment. Then you have all the pollution from the buses and the cars because everyone's living on top of each other. In these projects, you have the fire. They don't have fire escapes. On I couldn't remember that word. I had the COVID brain fog. It's called a fire escape. I was talking about the PCP, the angel dust that the kids are smoking. What they'll do is they'll climb up on the fire escape, and what they do is they'll leap off the fire escape. Couldn't remember that last time. Just had that brain freeze there. So now what we have is in the buildings, because you can't use the elevators, what they have is a cinder block walled off stairwells, and they're fire-free zones. But in those fire zones, in those stairwells, you have urine and your feces, and you have food they eat in the hallways, so you have that pollution as well. So that's not healthy. So we need to change our behaviors and try to live in a cleaner environment. At least, have you and your family and those neighbors clean up their surroundings to decrease some of that pollution. All right, so immunizations, important immunizations, influenza and pneumonia, the Pneumovax, are among the top 10, let's first rephrase this because I was getting ahead of myself there. Influenza and pneumonia are among the top 10 causes of death for older adults. So we place an emphasis on the influenza and Pneumovax shots, and this will help reduce the risk of developing these infections. Pneumonia remains one of the most serious infections, especially among seniors. So if you start, I would say if you feel something, okay, say something. Tell your family something doesn't feel right. So you need to come in and make an appointment, okay? Call my office or see your doctor. Now, we know it takes 6 weeks to get in, so what are we seeing in urgent care centers? Urgent care centers are starting to become geriatric centers. I know in the urgent care center that I work in, that we're starting to see an upward trend of seniors, 65 and older, even in the 80s, that are coming to see me. I'm starting to become a geriatrician where they just can't, they don't have the access to their primary care physician, it takes too long, or they have to be COVID-19 tested and screened. So instead, they come to the urgent care center and we test them there and then we treat them, or whatever their condition is, and then we treat them. However, they're starting to use the urgent care center as seen in Florida. They use the urgent care centers as their PCPs. And as I stated in so many other shows, that an urgent care center is not designed for primary care. It's an urgent care. You need to be able to offer continuity care, and that's what a primary care offers. That's what I offer. It's called continuity of care, meaning I start with you and I end with you. I see you through the treatment care, and I'm able to make the necessary changes so we can get the desired results. When you go to an urgent care center, you're going to have a different provider each time, and they're going to have a different perception and viewpoint, and treatment will be different. That's not continuity of care. You would have to present to the next provider coming on. That's what we do, so you know what's going on, so you can make the proper assessment and treatment. Okay, so we have 50 seconds left. I can't believe how quick this is. So I covered most of the stuff that I wanted to cover today, and I think this was good. Good information for our listeners. So if you want to learn about my practice, please go to drtomio.com. That's drtomio.com. If you'd like to make an appointment, you can call my office at 631-980-8200, or stop by my office at 250 Patchogue Yaphank Road, East Patchogue, New York, 11772. Or like I said, visit my website, drtomio.com. If you were involved in a motor vehicle accident, a loved one or family member or a neighbor, I am taking no-fault patients, meaning if you're involved in a motor vehicle accident, I can care for you. You get the same quality care. Call my office today.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.